Everyone in. All right.
Hey, everyone. I figured I'd show off my mask real quick before we dive in. Can you guys hear me? All right. So, Tom Breen can't hear. Can other folks? I see Shana can hear. Everyone can hear except Tom Breen. Mackenzie, can you hear? Michael Bingham's here. Can you hear? Tom, are you with us yet? Up he left and he's going to come back. Let's give him a sec.
Hydroxy, chloroquine.
We'll give it a couple more seconds, and if Mr. Breen, there he is. There he is.
I hope it's going to be a very important answer. We're having some very good.
I hear a familiar voice.
Patients and millions of doses of it.
All right, let's dive in.
29 million.
So as I'm sure folks have heard, the CDC is now recommending that people wear cloth masks. And we will be recommending that as well to the New Haven public. We're going to send a robocall out later today about that. And our goal is to make sure that as many people as possible comply with this. As has been stated by the CDC, the purpose of the masks is not to prevent people from contracting COVID-19. And it's important that people know that just because they're wearing a mask doesn't mean that they're any safer. What it does is if someone does have COVID-19 and someone that may not even be aware that they have it, they're less likely to spread it with their germs. And so we're encouraging people to wear the masks around New Haven, especially when they're going on one of those essential trips to the grocery store or to pick up some medicine. A couple of other quick updates. We have 181 confirmed cases in the city now and 6 untimely deaths. On the public safety side, 7 firefighters we're still at the number 7 for number of firefighters that have COVID-19, and 3 police officers, 3 sworn officers. We also have started to move individuals to the University of New Haven, our public safety officers. A reminder, those are officers that have not tested positive for COVID-19. It may be officers that are asymptomatic but have been exposed or are concerned about the potential for exposing their family, and that's why they are using the facility. Currently, we have, I know, 4 police officers that are that have moved over to UNH, and we'll start to move, open that opportunity up also to other folks in both the police and the fire department. Bella Vista has 4 positive cases. 3 are in the hospital, and 1 is on site in self-isolation. And then the only other update that I have is that the hotels that we have been working with in collaboration with the state to house individuals experiencing homelessness, we finalized the agreement with the second hotel. And so on Monday, we will be transporting a lot more people into that hotel to complete the transition. from removing people from homeless shelters and putting them in hotels in order to facilitate people separating away from each other. So those are all the updates I have. Do folks have any questions? Go ahead, Shana.
Hey, Mayor, thanks you for taking my question. Do you have any update, or do you know how what the ventilator situation is looking like at Yale New Haven Hospital? I'm hearing that there's some issues with running low as far as the supply. Do you have any word on that as far as the need at the hospital?
I know that there is an overall concern in the state about us not having enough ventilators, similar to every state out there. And we're seeing in New York City what happens when we don't have enough ventilators. I know it's a concern. There's a number of different shortages, and that's beds, that's personnel, that's masks, and ventilators is an additional one. And we were on the phone with the hospital on our daily call this morning, and that was one of the things that came up that they're concerned about as well.
Gotcha.
I
Do you
don't
have
have
a
exact numbers for you,
Okay.
but I do know that they're concerned about it.
Gotcha. Any word on staffing at Korea Regional?
We're almost there. We're getting closer.
All right, and you kind of broke up on the case numbers. Can you tell me just the updated numbers again for New Haven?
Sure, we have 181 confirmed cases
Okay,
and 6 deaths.
all right. And just final question, as far as testing goes, do you have a number or an idea of how many tests are being given out at these the drive-up sites in New Haven?
I don't, but generally the hospital reports that to us in our daily meetings. So I'm happy tomorrow to get that information and share it.
Awesome, thank you.
Mhm. Other questions? I see Mackenzie's hand up.
Hi, Mayor. Thanks for taking my question. I was wondering if you could provide a little more detail on the movement that you're expecting to see early next week for homeless individuals. I know that the city just finished emptying one major homeless shelter. Do you have others that you're like focusing on for next week? And are you eventually going to try to get all people out of homeless shelters? Kind of like, what does the timeline look like on that?
So yesterday, they completed moving a large group. And at the end of yesterday, they were estimating that a total of 139 individuals that are experiencing homelessness are in hotels. I don't have exact numbers on the additional group that will move on Monday, but my understanding is the group on Monday will complete, by and large, the process of moving homeless individuals into hotels. Now, of course, anyone that has any following of the issues around homelessness in New Haven knows that it's a bit of a moving target, and that there's a lot of different people in different kind of scenarios with homelessness. And so, of course, it's not going to be every single person that we will be able to house, or we will have housed in hotels. But the goal is that the vast majority are in hotels.
And just a quick follow-up on that. Obviously, like the main point of contact right now is the homeless shelters that are still housing people. What steps do you anticipate the city taking to connect with homeless individuals who are not currently staying at a shelter?
So a number of the shelters will have caseworkers at the hotels to keep monitoring folks. If individuals still are homeless and are not in one of the hotels, they can be connected through the CAN, the Coordinated Access Network, and through 211 into the system. And as is always, there's a number of other entryways into the system. There's still a number of emergency food providers, for example, that while they're not physically allowing people inside of their sites, they are still offering food. And so conversations with other people that are in the social services network in New Haven can help people get the right resources to access support for homeless individuals. Does that answer your question?
Yes, thanks so much.
You're welcome. Mr. Breen, you're late.
I listened on YouTube. It was great having an alternate way to do that. Thanks
Didn't miss a beat. Good job.
But maybe to you and to Director Bond, could you tell us a bit about the 6 fatalities, or I guess it's 2 more since yesterday? And are you saying that the city is confirming that that is the number of local fatalities, or are you still double checking death certificates for those as well?
Go ahead, Director Bond.
So our number increased in our surveillance system to 6. Of course, we will cross-reference that with our vital records division through death certificates, but that is what is being reported through our surveillance system at this time. In regards to your question on the age range, it is another elderly, 2 additional elderly individuals. So right now the range is from 57 to 93. 57 was the first fatality that we had in our city. And then the oldest has aged 93.
And you don't have to list the age, or you don't have to list the age of everyone who passed away, but are there people in their 60s and 70s as well? Or is it mostly closer to the 90s?
It's a range. We have 57, 65, 70. So we have starting from 57, but we do have 1 individual that was 65.
Thank you. And Mayor, I saw the governor's office sent out a slide deck yesterday afternoon with a graph projecting when New Haven County and other Connecticut counties should expect the peak of hospitalizations. And it looked like the expectation for New Haven County's peak is sometime in late April or early May. And I know you talk every day about preparations the city is doing to, make sure that we're as prepared as possible for this pandemic. But have you seen those graphs, and what can you say about how the city will be responding to that anticipated peak of later this month or early May?
I can say, hang on just a sec. So this is what you're talking about, Tom, correct?
Looks like the screen hasn't started sharing on my side yet, but it most likely, yes. If it's that, I think there's like a yellow line and a green line and a red line.
Correct. So we've been anticipating that the spike happens in the next several weeks to 3 or 4 weeks out. And so what the governor's graph shows doesn't surprise us. I think that the main thing that we are, and many do not know, is the height of the spike. And if you know, the governor's graph doesn't include numbers on the y-axis. I presume that they did that intentionally because there's a lot of uncertainty on their end about how many people are going to contract the virus and how significant the impact is going to be on the overall healthcare system. But the spike itself, or the timing of the spike, doesn't really surprise us. Obviously, it's hard to know within a week or 2 that timing is what we've been working to prepare towards.
And then thank you. My last question is about the city beginning to move public safety officers into UNH. Does that mean that the city has signed a formal agreement with UNH?
It does.
And will that be made public?
I presume it is public. I mean, it's a public document. I mean, I can check with our corporation counsel about it, but I presume it would be made public. I mean,
can you say now how many people UNH will house according to the agreement?
I don't remember if that number was covered in the agreements. I do know that we had a conversation about 150, 160 individuals that I see Chief Alston confirming. Are there other questions specific to that site that you're interested in regarding the contract?
Nothing in particular. Just now that it's signed, I'd be interested to see what it says.
Okay, thanks.
And that's it for me. Thank you very much.
Other questions? Other questions? Going once, going twice? All right, thanks everyone. Have a good one. Take care.